Hi guys, I want to tell you a story. I had an auntie who was actually admitted in the ICU, in the intensive care unit of the hospital because of arthritis. And my auntie actually is a distant relative from Leyte. When she came in, she was already in the ICU because she was self-medicating with so many different painkillers and supplements. And I want you to realize when you take medicines and supplements, please realize that they do have side effects and not everything you see on the commercials is true. So I want you to be very careful. I do not want you to end up like my auntie in the ICU on dialysis and then bleeding gut. So anyway, our topic for today is really interesting. It's about supplements. So if you don't know who I am, I'm Dr. Jonathan Flordelis. We are going to talk about arthritis supplements, specifically that for osteoarthritis. So let's discuss. Hello, good afternoon. This is Dr. Joff and welcome back here in my clinic. I'm here at the Cebu Orthopedic Institute and today I'd like to share with you some of the things we discussed with my aunties last weekend about arthritis. So as you know, there are many types of arthritis, and one of the questions that they had for me was actually about the different supplements. What is the best supplement for arthritis? And because there are so many types of arthritis, it's really difficult to choose one best supplement. So when we talk about osteoarthritis, this is important because osteoarthritis is not the same as osteoporosis. If we talk about osteoporosis, it's actually brittle bones. So when they ask me, what about calcium? Is calcium the best supplement for the bones? Yes, it can be a very good supplement for the bones, especially if the patient is 60 years old, postmenopausal, or even male that's 70 years old and above, because even males can get osteoporosis. Now, what is the ideal dosage of calcium? In elderlies, we need to have calcium that's at least 1,200 milligrams. And it doesn't mean that you need to take a 1 gram tablet because you can actually get calcium from a lot of different sources. From milk, you can get it from food, like cheeses and even seafood and seashells. And you can supplement it with calcium, and then that you can actually get that 1,200 milligrams per day of calcium requirement. Now, just to be clear, when I talk about calcium, we're talking about the bone. So if we are talking not just about the joint, because for the joint, this is the knee joint here, the blue is the joint. We're talking about calcium, which is good for the bones, and the bones means you can have improvements of bones all over your body with calcium, especially if you have osteoporosis, which actually means brittle bone. You need a lot of calcium. There's also a question yesterday or the other day about vitamin D. Now, vitamin D is really important because it helps absorb your calcium for the bones. So you get this from sunlight, and you even have supplements that have calcium plus vitamin D. So it's 2 in 1, and you have them together, calcium and vitamin D in one pill, and that can be in different brands. So for vitamin D and calcium, they're usually taken together in combination, and that is for osteoporosis. But when we go to osteoarthritis, again, we need a supplement that's for the joint. This is the joint, this blue thing here, and not for the bone, not for the white stuff. There are many arthritis, but we are speaking specifically of osteoarthritis. If it's osteoarthritis, what we usually give to our patients are supplements like slow-acting drugs like glucosamine sulfates, and there are so many types of glucosamine sulfates, but when we talk about the pharmaceutical grade type, these are usually the glucosamine sulfates that are in powder form, not usually the ones in pill or tablet form. If you have glucosamine sulfates in pill form or tablet form, they are still okay, but they may be diluted and mixed with other supplements. It could be glucosamine plus this or glucosamine plus that. These are still okay for the joint, but if you really want what you really want for osteoarthritis for your joint is the pharmaceutical grade type, which is usually in a sachet and it's in powder form. There's also been questions about collagen and about milk. Let's discuss milk first. Yes, milk has calcium. Yes, they can put glucosamine in the milk, but remember, the calcium and the milk, it's usually a supplement for the bones and not necessarily just for the joints. So it is a whole nutrient. It can be a complete meal for you. It can be actually a meal replacement. So for milk, it can be good for you, but be careful if you are lactose intolerant or if you have some other type of arthritis. Because if you have a reactive arthritis, we do know that there is a connection with your joints and your gut. That means there's a connection between the arthritis and what you eat. And if you have certain allergies to milk, this may not be the best supplement for you. And that is why it's really important to know what type of arthritis you have. Collagen, on the other hand, is good for the muscles, it's good for the tendons, it's also okay for the joints, and a lot of different bodily functions as well. Because as you know, a lot of our body is made of collagen. Our hair, our muscles, our skin is actually made of collagen. And this has been a supplement that's been used for years. This is all the time I have for today, but in the future, we'll discuss more about arthritis. I hope this was helpful to you, and this is really important. So I hope that you know each supplement, they can actually still have adverse effects. Nothing is completely safe, and I want you to be careful. Please see your joint specialist. And when I say joint specialist, you can go to a rheumatologist. If there's an orthopedic that actually specializes in the joints, you can go to them as well. Of course, there are other specialties that are also ortho who specialize in the spine, the hands. You'd want to go to an ortho who specializes in the joints. I hope this was helpful. I'll see you soon. Bye-bye.